مسكين نعمل اول سيستس سكوبر سيستس وبعد كده هنكمل الكيلوموتايتس. بعدين نعمل زي تسليم ونخلص باذن الله ونطلع للاسم. بعدين السيستس هم سكوتر سيستس طبعا الموست فيمس سكوتر سيست. اشهر سكوتر سيست معروفه طبعا هي الهايدروسيل طبعا لكن we've got other scrotal cysts. The scrotum is a hairy area and it may very well develop multiple. If you hear the word hair, then there are the related glands, any glands related to hair. Sebaceous, طبعا sebaceous cysts. Then they will develop anywhere in the body except one part of the body, the part of the soles. شايفين عارف ان الفانز والصوص ما فيهمش سوات جلاندز قصدي سيبيشس جلاندز سيبيشس متأثر سيبيشس طبعا مش بيطلعوا سيبيشس سيستس لكن السكروتم مشهور انه بيطلع multiple سيبيشس cysts like very similar to the scalp. The scalp is the other area in the body that develops that leads to the development of multiple cysts obviously because of the hair. Okay. في سيبيشس سيست في هايدروسيل لكن في تو اذر سيستس هم مرسومين زي ما بيقولوا. انا دايما بحب ارسم الرسمه بتغني عن مليون كلمه زي ما بيقولوا ولا 1000 كلمه. There are two cysts, what we call spermatoceles and epididymal cysts. There are two other scrotal cysts لكن طبعا the most famous scrotal cyst is the vaginal hydrocele. In fact, the most famous scrotal swelling is the vaginal hydrocele. Okay. The vaginal hydrocele obviously is the most famous scrotal swelling and cyst. Obviously, a vaginal hydrocele is a purely scrotal swelling. Well, you all know that when you assess scrotal swelling, the first step that you perform is to decide whether it is inguinal, inguinal scrotal, or purely inguinal, as well as purely scrotal. Okay? Right now, we'll be discussing a lot of scrotal swellings. We're very shortly we'll be reviewing them in a list. Somewhere in a handout with you already. Like all the two remaining cysts, sebaceous cysts. Sebaceous cysts on the scrotum caffeine, that skin is very thin. You can see the white sebum through the very thin skin of the scrotum, and the scrotum is particularly thin. It lacks fat. It does not contain any fat, so that the doctors can regulate the temperature and so forth. The scrotal skin is characterized by its thinness. Well, that is why sebaceous cysts the sebum may be seen through the very thin skin. لكن غير دول عندنا هم spermatocele and epididymal cyst. Sometimes they are discussed as one entity. لكن there are a few differences in fact. وهم diagrams هم. Spermatocele obviously contains spermatozoa, and it's not clear. Its code is not clear. زي ما بنقول it's barley water-like. فزي ما هي مرسومه كده. طبعا this is the SS with the clinical in front of it, the epididymis is behind it. The classic anatomical configuration with if the thing is reversed. لو هي reversed بيقولوا عليها بيسموها ايه؟ الانتي-version. بيقولوا عليها anti-verted testis. If the clinical lies behind and the epididymis lies in front, this predisposes to torsion. One day we'll be mentioning that. لكن هو شايفين السبرماتوسيل lies where does it lie in relation to the testis? Above and behind. It's above and behind. It is above and behind. While in the cyst lies strictly speaking behind. واحدة above and behind, واحدة behind. You draw the diagrams and that's it. And you remember one. Because it contrasts. You don't keep thinking of this and that. You just keep thinking of one and then you reverse it. If it contrasts, in this case it contrasts because at times it will not contrast. In short, one is black and the other is white. At times one is black and the other is red, for example. أنا بتكلم أي مثال. لكن هنا they contrast. It's unilocular. زي الدياجرام ما بيوري. It contains a barley water-like fluid, and then it may not be as translucent as you think. If you perform transillumination, it may not be as translucent as you think, because obviously it's barley water-like, and بتبقى turbid، ما بتبقاش كريستال كلير يعني ما بتبقاش كلير. وطبعا اس اند اس it is soft. دي اس relates to the s. It is soft in consistency. عشان كده انا برسمها الرول بتاعتها a bit corrugated. The cysts in general have got a very small bore. عارفين cysts in general have got a very small bore. And you've been seeing a lot of these. You've been seeing a lot of these on CTs. You've been seeing a lot of cysts everywhere in the body, in the skin, in the liver, مش عارف فين هنشوف الكدني كمان. لكن that's spermatocyst as opposed to an epididymal cyst. epididymis I hope انكم عارفين epididymis يعني ايه epididymis؟ epididymis يعني testis. Epididymis on top of the testis, around the testis. The epididymis is the testis. If you do not know how to write it properly, because it's well worth knowing how to spell words and write words. This is not important. It gives a good impression. Okay, you will not be when someone is reviewing your exam paper or show consent. They not review the spelling mistakes. It gives a good impression. There are no spelling mistakes. If you write an article, if you write the thesis, if you write anything, these things at times are full of spelling mistakes, and it's appalling. You can even check it. You do not need to have to exert any effort. You can check it with any of these systems that checks for spelling mistakes. It's very, very important. فبيقولوا if you did cross هي did يعني دي ID انها did. انتوا عارفين طريقة تقسيم الكلمات. If you want to remember how to spell a word that you are not very familiar with, you divide it into syllables. You divide it into مقاطع. كل مقطع بإبي معروفة وبعدين did. كده اللي هي الباست بارتيسيبل بتاعت ولا الباست تنس بتاعت دو. فديد وبعدين بعد كده الواي. إبي did المس والإبي السيست بالعكس ان هي قولي بقى هي مرسومة. إبي did السيست. Epididymal cysts, Mahmoud, epididymal cysts, where do they lie? They lie behind, and they are multilocular, unilocular. They're multilocular, as the diagram describes. It's serous, the contents are serous, but they're clear, the contents are clear. Contrasting with if you aspirate hydrocele, it's yellow in color. If you aspirate a spermatocele, it is body water-like in color, and if you aspirate a typical epididymal cyst, it is clear. It is clear, serious, and it's clear. It hasn't got any colors. Okay, it is tense as opposed to the softness of the SMDS. The SMDS, the spermatoceles are usually soft. ما اعرفش بقى ليه مش مهم. مش معنى ان الواحد مش عارف explain the facts. I mean, these are two different things. You may know certain facts, you may not know how to explain them. This is a fact. Goal الفلو طبعا بيتقال عليهم the third testicle. بيتقال عليهم the third testicle because the impression that we get is the transporter compartment contains more than one thing. The testis and something else around the oval thing that is separate from the testicle. Come on, the diagram shows that these are separate from the testicle. Yes, they may be very close to the testicle, yes, but you feel two swellings, two separate swellings, the testicle and then the cyst. While a hydrocele, a vaginal docele will not do the same. The hydrocele, vaginal docele surrounds the testicle, but you feel one thing with the testis in the middle of the thing that you felt. أنا متأكد إنكم إحنا اتكلمنا عن الكلام ده وضوح. Vaginal doceles are very typical, short يعني OSCE question, very typical. الأورجن ده بيبقوا form of potential cysts من السبرم conducting system بقى مش عارف الفازا افرنشيا ولا ريك testis, and sometimes انتوا عارفين انه في in the region of the head of the testis there are vestigial remnants, cystic remnants كده vestigial من female ducts that usually disappear. These are the origins. But apart from the origins, this is how they look. The spermatocele or a diagram is very easy. مش موجودة في الهند ودي حتى. It just mentioned كده within the differential nodules of a scrotal swelling. Okay, the spermatoceles lie above and behind. They lie above and behind. Above and behind. They usually derive from the region of the head of the epididymis. Above and behind. Or before that, the sperm conducting system. conducting the system that conducts the sperms from the testes to the outside. So that is why they sequester a few spermatozoa and then they contain body water-like fluid. They may not be translucent. If you eliminate them, they may not be translucent. Obviously, because of their content that simulates semen, it's semi-local and it's soft. It is soft. The softness of the spermatozoa, the S and the S, as opposed to the tension. And if it didn't cyst, it's usually tense. It's multilocular. It's clear. Its contents are clear if you aspirate them. طبعا انتوا عارفين that we're almost always very inclined to aspirate cysts. Cyst aspiration is both A and A. Diagnostic and therapeutic. Cyst aspiration. If you aspirate a multilocular cyst, obviously it will be much more difficult to retrieve. Get back, retrieve fluid. And then it's very difficult to treat it by aspiration because you'll never be able to puncture all oculi. لا مش هرد وهصمم على التليفون كده عشان كده مش هقول لكم معلش هرد لا لكن دي حكايه الانسيس on the other hand زي ما انتوا بتقولوا كده lies behind and it contains clear fluid and it is multilocular. If you eliminate it, it's clear, but it may give you these dark septa. The septa, which divided into loculi, may not be translucent. Obviously, I'm sure you can understand that. Where it's crystal clear, it's clear, and it's dense as opposed to the softness of a spermatozoa. بالتالي بقى كفايه على كده. لكن remember that the main differential diagnosis is that from an insisted hydrocele of the cord. Insisted hydrocele of the cord. فاكرين we're talking about types of hydrocele قلنا who knows how many types of hydrocele have we got. مين عارف قول يا مين قولي كام نوع. congenital, infantile. The knee knows them really well. الني مجتهده جدا جدا. انا بحترم جدا انها بتقعد تقرا تقعد تطلع يعني عاوزه تعرف اكتر واكتر. ف she's mentioning them that it's a congenital type, infantile type, vaginal, insisted hydrocele sac. It insisted hydrocele in particular gives the impression that it is swelling separate from the testis. It's very similar. In the insisted hydrocele of the cord, usually there's a gap between it, there's a space between it and the testis. And if you pull on the cord, the testis so that the cord becomes tense, the mobility of the insisted hydrocele is lost, while in this situation it does not change. And هنا هي ماسكه في التستس وما بتفرقش. انتوا عارفين this trick, you differentiate these cysts in your textbook. They've written epididymal cysts and spermatoceles sort of together. They're written together. But if you read through them, you'll find that there are differences. If you read through them, you'll find there are differences. Whether we call them one thing or whether we call them better two things, it doesn't matter. But what really matters is to differentiate them from an insisted hydrocele of the cord. With insisted hydrocele of the cord, it's a bit away from the testis. And if you pull on the testis because the cord becomes tense, the side-to-side movement is lost. Then you cannot move them side to side. The knot and the bead. The string, the knot and the bead. فاكرين الخرزة والعقدة والحبل والقصة القديمة اللي احنا بنقعد نقولها دي كتير. اوكي؟ بعد كده نرجع نتكلم على مين بقى؟ نرجع نتكلم على الابيديديمورفايتس. احنا we've been talking about non-specific epididymorphitis. We finished that. ومرة ثانية أقول لكم the age factor is extremely important. And if you're dealing with a young individual, a child, a male child who is not sexually active, then you should not be thinking of epididymorphitis unless for some reason they've got an obstructive neuropathy, maybe you passed a catheter, maybe you passed an instrument or anything else. Otherwise, they do not develop epididymorphitis, and it's very, very important to remember that. لكن بعد كده بقى خلينا نتكلم على ايه؟ خلينا نتكلم على specific epididymorphitis. وقلنا leprosy. هنخلص الموضوع ده باذن الله دلوقتي. هنبتدي الفاريكوسيل ان inshallah, on leprosy. What does leprosy cause? Testicular bronchitis, atrophy, gynecomastia. One, بعد اتكلمنا عن TB in detail. اتكلمنا عن TB in detail. We're talking about the fact that there is a tubercle. The tubercle may attain large size and it may become a tuberculoma. There may be tissue destruction in the middle, the so-called caseation. Then the caseation will start to create the typical tuberculous ulcer with a caseous floor. Obviously, the floor is caseous because it is stuffed. The material stuff was caseous. The floor is caseous. The edges are undermined. The margin is cyanotic, and it is usually a soft ulcer. It's not indurated. قلنا الكلام ده قلنا TB heals by fibrosis and it causes calcification and fibrosis. قلنا الكلام ده قلنا it's usually a disease of ducts. TB is designated as a disease of ducts. قلنا applying this thing to the male dental system. قلنا there may very well be a beaded vase. Can it be a beaded vase? The vase is beaded because there are tubercles and it's duct-borne. It's not blood-borne. It may be blood-borne, but this is rare. It's duct-borne, and if it's duct-borne, it travels along the vase, causing tubercles along the vase. So you find the vase as a separate structure, but it will be needed because of the tubercles. And then it reaches the tail of the epidermis and create a lesion of the tail of the epidermis, a tubercle that may enlarge in size and then slap posteriorly, creating a typical posterior tuberculous ulcer. Now, these scrotal ulcers may be tuberculous, may be syphilitic, maybe squamous cell carcinoma, but they may also be a disease that starts with a B, and maybe Behçet or a Bahgat or a Behçet or whatever you want to call it. The Turkish dermatologist can describe the disease that is very typical when you develop where usually males develop oral ulcers, but females can develop the same oral ulcers, genital ulcers, but also eye manifestations. And more important in the vascular arena يعني environment يعني they develop DVT, develop thrombophlebitis, develop aneurysms, develop arterial occlusions. Okay, they develop a form of arthritis and phlebitis. بنتكلم عليها وقت ما تيجي. Okay, scrotal ulcers, the anteriorly situated ulcers are syphilitic. The posterior situated ulcers are tuberculous, squamous cell carcinomas of the scrotum. Behçet وبقى traumatic ulcers مش عارف whatever بقى heads ulcers and talking ulcers are a typical exam question. فاتكلمنا عن الTB. There may also be a nodule that we better call a tubercle بقى. A tubercle felt as a nodule of the epididymis, قصدي of the seminal vesicle and the prostate. هو بيجي لهم من فين الديزيز ده؟ من اليورينري. بيجي لهم بيبقى البني ادم عنده urinary tuberculosis, and then it travels along the ureters and into the bladder and then into the prostate and then to the seminal vesicles and to the vase. That usually starts as the secondary tuberculosis because there's no secondary tuberculosis in the urinary tract or in the dental system. واتكلمنا على الكلام ده. يمكن كانت كلمة واحدة بس ناقصة. انتوا عارفين when you got these very high rocks في كده صخر بيبقى عالي قوي pointed بيسموهم cliffs يعني whatever the term بيسموهم crags كمان بيسموهم crags يعني very high rocks rocks obviously الصخر ده بيبقى very hard بيبقى pointed they derive an adjective from something that is firm or indurated and with an irregular surface or a vacillated surface and they call it craggy. A rock, a rock is hard, obviously. It has a pointed surface, is regular and pointed at certain points. They call it crags. ساعات they apply the word. مش عارف ليه بس بيقولوا في الTB these lesions feel craggy. They give the craggy sensation. Whatever بقى انتوا عارفين one of the things that impresses people is that you use the terms that they use. Yani if you travel to a country and then you keep saying hello in their own language, they become really impressed. You may know nothing at all. You're carrying a guide and then you're looking at hello, مش عارف اسمها ايه, goodbye اسمها ايه, and then this is what you do. But you know nothing about what you're saying. In fact, But it's very impressive if you enter the exam, whatever role, and then you use the terms that we use, it impresses us. Whatever, they use this, the first practitioner who used this term, بس it's almost coined يعني زي كده مسمرة للTB. يعني if I hear someone talking about a posterior scrotal ulcer and a nodule in the tail of the epididymis and the middle bars that give the craggy sensation, these nodules, and those of the prostatic scales, I know that they're talking about TB, and I know more that they've already been through the literature. And one of the things that we want to make sure of is that you read through the medical literature. Whether you understand it, you don't understand it, this is another issue. It's the beginning, we don't want to make sure that you've been reading through it. Two words on beaded, the craggy sensation or craggy feeling. They are a bit towards the hard side and they brought an irregular ulcerated surface. TB. The treatment of TB is basically anti-tubercular statement. You may think in terms of removing the epididymis and the bars. Do you remove the testis? No, because if testis not barrier, we don't remove innocent things. We've stopped removing innocent things. In the past, surgeons were very happy removing things. In the present, surgeons are very happy when they can spare things. They changed. They've known how precious things are, but they don't just keep removing things. It is dangerous, and at the same time, useless to remove things that you don't need to remove. فادي الTB فرصة لو كنا نعمل عملية نعمل epididymovasectomy, but we won't remove the testis because it's very unusual for the testis to be involved. There shouldn't be commonly a hydrocele because the testis is not pathological. بعد كده اتكلمنا على السيفيلس. كل مراجعة عندها syphilis or syphilis, and the syphilis بيبقى basically what syphilis is an endarteritis, and it's basically what is syphilis basically. How does it affect the testis? Where? Anterior, it's an orchitis. It's again very similar to leprosy. It's a syphilitic orchitis. That syphilis is in the main genital system. Apart from the primary بقى احنا ما بنتكلمش على البرايمري ده اللي هو الجانكرز and so on. احنا بنتكلم طبعا الجانكر بتاعت السيفيلس قلنا كاركترستيكلي بتبقى ايه؟ بس بتبقى هارد ترانجوليتد. بس بيسموها هارد شانكر لانه as opposed to softness of soft شانكر دي نوع تاني من الشانكر، لكن السيفيليك شانكر بتبقى it's very similar to the palpation of the bottom. You keep feeling your shirt and your trunk, and then at the region of the bottom there is something of very different consistency. فبتعمل syphilitic orchitis. And if you hear the term orchitis, there follows two things. When the testis is inflamed, obviously it's maybe inflamed. It's sheath. الشيث اللي هو اسمه ايه؟ الكيميكال. يبقى there may very well be a hydrocele. If the testis is inflamed, there may very well be a hydrocele. Very similar to when something is inflamed inside, when the appendix is inflamed, there may be a peritoneal reaction. فنفس الكلام. اوكي؟ فتلاقوا السيفيلس ممكن يبقى معاه hydrocele because it's basically an orchitis. It's either diffuse orchitis, but the typical form is localized orchitis in the form of a gamma. انتوا عارفين stuffing in syphilis is called gammatous affection. With this gamma, it's degeneration. The area dies, it sloughs, and it creates an anterior ulcer. يبقى syphilis هو tertiary syphilis. Localized gamma وanterior ulcer اللي هو two features. It's punched out and it's got wash leather floor. A wash leather floor in contrast to the caseous floor of the tubercular ulcer. A wash leather, when I get the wash leather, this piece of leather that you take from the chamois, the poor chamois that you take, it's leather, and then we use them as jackets for us. بنعمل كده. And sometimes we use these as a piece of cloth to clean glass, and يسموها wash leather. Wash leather, يسموها the wash leather appearance. The wash leather appearance, a punched out edge. The these are typical. قلنا قبل كده كمان in one day after a few weeks كده 8 or whatever weeks بإذن الله discussing the tongue and we're talking about طيب كان بيجي فيه tuberculous ulcers بيجي فيه syphilitic هيبقى لهم نفس الفيتشرز هيبقى لهم بس يبقى لهم مكان مختلف التي بي تيجي على التيب مكان يبقى فيه اعوذ بالله سبيوتر بتاع tuberculous سبيوتر والسيفيلس تيجي في الميد لاين تيجي في الميد لاين والتروماتيك ألسر تيجي مكان التوث لما يبقى عنده bad tooth a ragged broken tooth the side of the tongue keeps rubbing against the ragged tooth ragged and broken and it ulcerates and this is a dental ulcer عشان تبقوا عارفين من الاول بس الدنتال بتيجي على الجنب وبتيجي على التيب هو طبعا السيفيلس بتيجي mid line even though we got the same characters if we talk about tuberculous ulcer anywhere you remember Achilles floor the lumen edge on the stenotic margin and if you talk about how do you call it gummatous ulcer tertiary syphilis and ممكن السيفيلس طبعا يبقى primary syphilis like a tertiary syphilis you talk about wash level floor and then punched out edge okay هنا هيبقى فيها دوسين كمان ليه لان هيبقى فيه orchitis anterior when is the syphilitic ulcer posterior anteverted الكلام العظيم ده anteverted testis obviously the testis is anteverted so that the didymus is posterior then the tuberculous ulcer is posterior and the syphilitic ulcer as the tuberculous ulcer becomes anterior هو usual and the TB ورا والsyphilis قدام if it's anteverted is the reverse ولا الموضوع الثاني ولا قصدي بقى ننتقل للكلام الثاني اللي هو البلهارزيزس والبلهارزيزس is said to be a disease of disease of ايه؟ disease of veins TB ducts والفلاريا obviously الفلاريا disease of acute lymphatics والsyphilis is the disease of arteries tertiary syphilis is the disease of arteries فالsyphilitic orchitis is the arteries والTB epididymitis is ducts والبلهارزيal because it's a panniculitis. Remember that in this first box, we've been specifying it's a tuberculous epididymitis basically, where it's a bilharzia panniculitis because where do the veins lie? Where do the veins lie? Basically in the sphenoid cord. Talking bilharziasis is after a plexus of veins. يعني الأوفا قصدي الورمز اللي هم الهيماتوبيوم والمانسوناي والمانسوني they're after a plexus of veins because this is where the thin female will be able to lay the eggs so that the eggs pierce the veins and get to the outside. But unluckily, in this situation, there will be no outside. There will be outside. The worm wants to complete its life cycle. So the favorite location obviously is the bladder, the rectum. The bladder, the rectum, so that when the ova are laid in the submucous plexus and the organ contracts, the spines will pierce the mucosa and will get to the outside. Thus, if these plexuses are blocked, فاهمين دلوقتي bilharziasis is a disease of veins. وخلاص gone are the days of bilharziasis. بقى دلوقتي عندنا الحمد لله كنا زمان نقول bilharziasis دلوقتي عندنا other public health concerns. لكن برضه it's I don't think it's a good idea not to study bilharziasis at all because then it gives a very bad impression. كانوا بيقولوا venous plexuses. Thereafter venous plexus, you all know that hematobium, schistosoma hematobium will cause which part of the body? Urinary, mansoni will cause rectal, but mansoni can cause urinary and vice versa because there are collaterals, they live in the portal vein, and then when the female decides it's time for ovary deposition, the male, which is thicker, has got this groove, it carries the female, and they swim they go against the blood until the male cannot go anymore because it's thick, and the thinner female will leave the male, will travel to the least possible venue where it will lay the ova. Usually, this is a submucous plexus. A submucous, so that it gets to the outside. When the submucous plexuses are all blocked, it will go to the peri-organ plexuses. The plexuses around the bladder, the plexuses around the prostate, then the feet, a perivascical, a periprostatic plexus. But this is no good. هي مش عارفة. The world does not know. It's not good play because it will not lead to the ova coming to the outside, going to the outside. They'll be blocked. بس at the expense of the host. لأنه these ova are deposited obviously بيعملوا برضه granulomas, inflammatory reactions. The ova are present in the middle instead of the mycobacteria, and the inflammatory cells and fibrous tissue, fibroblasts, giant cells around. يعملوا بالهارزر granulometer. يعملوا بالهارزر granulometer in the area of maximal venous plexuses. But they don't lay their ova in the cava, for example, with the portal vein. They don't do that. They lay their ova in an area of maximal plexus. Where does this exist in this area of the body? الفامبينيفور plexus دي موجودة فين؟ في السباينال cord, below the external ring. Because the higher we go, the lesser the plexus. بتبقى strictly speaking intrascrotal, وبتبقى it starts as a perivenous lesion with a lot of inflammatory and fibroblasts. Okay, inflammatory cells and fibroblasts. فدي حكايه بالهارزيزس. Connected to the outside, venous plexus is connected to the outside. Once occluded, other plexuses become affected. Bilharzia granulomas of different sizes. Bilharzia granulomas of different sizes. They may be granular, maybe nodular, maybe massive. نفس الكلام maybe granule, nodule, أو a large mass. هما بيعملوا كده، مش حاجة أكتر من كده. وهو فيهم إيه؟ فيهمش حاجة. بالظبط كده. A foreign body, whatever this is. Mycobacterium tuberculosis in TB. That's in this situation the ova. The ova in the middle, whether they're hematobium, whether they're Mansoni, and they're surrounded by the fibroblasts, the chronic inflammatory cells, the lymphocytes, مش عارف القصة دي, and at times even, giant cells and calcification. Calcification of seminal vesicles in this country is typical of bilharziasis. عشان تبقوا عارفين, if you look at a plain UT, a plain film اللي هو PUT, بيقول عليه PUT, plain UT, أو ساعات بيقول عليه KUB, kidney ureter bladder, بيقول عليه KUB. هتلاقوا with the images, the plain films, there is written KUB meaning kidney ureter bladder film. أو يقولوا عليها PUT, plain urinary tract. When this situation we find calcification of the seminal vesicles, it's almost synonymous with calcification down of the bladder of bilharziasis, but it can also develop with TB. Okay, ولا بيبقى عنده seminal vesicularis كتير, يبقى عنده hemospermia, one odd manifestation. يبقى عنده ساعات a lot of times يبقى عنده hemospermia. Okay, فدي حكاية they calcify and they fibrose. طبعا the treatment is anti-bilharzia. فيهاش يعني حاجة كبيرة. If you're doubting the origin of the nature, يعني the nature of the lesion, obviously you can biopsy, but usually you give them anti-bilharzia. يبقى هنرسم على الرسمة دي، الرسمتين قلبينها بشكلهم وحش قوي. هنعملها بالأزرق عشان هي البلهارزيزس is a disease of ايه؟ veins. TB is a disease of ducts. And this in itself it's all the pathological lesions. والفيلاريا is a disease of lymphatics. فبيقولوا البلهارزيزس there may be a nodule of the prostate. ليه في nodule of the prostate؟ بالظبط periprostatic, because there is a periprostatic plexus. في nodule of the seminal vesicle اللي فيه periprosaical plexus, and then the intracanal part of the cord is completely normal. It is the intrascrotal part of the cord that is affected. Intrascrotal, because this is where there is a plexus. The vase is not affected. مالهاش دعوة بالvase. الvase مالهاش دعوة because it does not travel along the duct. It does not cause a lesion of the duct. It causes a lesion of the veins in the cord close to the vase within the scrotum. Okay? فبتبقى شكلها عامل ازاي؟ يا اما حاجه granular, يا حاجه nodular, يا حاجه تبقى massive. Okay? But the vase is still felt separate. ليه؟ لان انتوا عارفين if the vase is not felt separate, this is typical of filaria. معلش عشان انا متاسف. الحمد لله. بس انا السترين جاي في المكان بتضايقني، بس انا بحاول قوي افضل قاعد في مكاني لاسباب كتيره. لكن the vase is still separate. If you do not feel the vase as a separate structure, it is typical of filaria اللي هو بيسموها matted cord. يقول عليها matted cord. One of the things that we examine when we examine the main jointed system, obviously examine the cord, and you want to identify one structure in particular as a separate structure اللي هي the vase. عارفين الحكايه دي قلناها and we'll feel it very soon. We'll get one of these professional يعني مش عارف اقول professional patients, لكن we'll get them and we'll palpate the vase and the clinica and so on. بس once we've done with the nerves, and I bقيت obsessed عاوز اخلص النيرفز بسرعه. we're getting very short of time. With bilharziasis, the median nodule of the prostate, and nodule of the seminal vesicle, similar to مين اللي بيعمل كده برضه؟ التي بي بيعمل نفس الكلام. بس then there's a mass of variable size. It may be granular, maybe nodular, maybe massive. Strictly speaking, within the cord, as within the scrotum. The cord within the scrotum. It does not ascend into the canal. And the more you ascend in the canal, the more you get 1 or 2 or 3 veins. We don't want that. We want a plexus. It's interested in a plexus that simulates the submucous plexus of the bladder or the submucous plexus of the rectum. Bilharzia proctitis, bilharzia cystitis. These are the basic lesions of bilharziasis. And هنتكلم بقى بعدين لما الوقت يجي. بس احنا النهارده بنتكلم على disease of veins. Well, maybe granular, maybe nodular, maybe massive. It is localized to the scrotum, does not ascend into the canal. It is separate from the vase. وساعات يبقى فيه more than one nodule, one on top of one another. يسموه bilharzia rosary. عارفين the rosary that we use when we are asking God for something and when we're praying and so on. بيسموها bilharzia rosary. يعني bilharzia rosary. في terms كده قلنا مع التي بي. a beaded vase and the craggy sensation. Okay, دول عايزين يبقوا highlighted. With bilharziasis, it's a bilharzia rosary. And it's strictly speaking, intrascrotal pathology بينهم. There may be ممكن يبقى فيها لوسيل عشان ده بينز. صح طبعا. هنعمله هنحطه عشان نراجع حاله ما تتخرجش حرام. فاهو هيحطوا فلويد جوه ده. وساعات كمان تبقى حاجه اوحش. ده ساعات كمان the skin becomes involved. At times the skin, طبعا skin involvement is very typical of skin. مين اللي بينفولد skin؟ او subcutaneous tissues يعني بلاش skin. انهي واحده من السيفيلس ulcers لكن اللي بينفولد these lesions is filaria. الفيلاريا بتعمل lymphedema. فانتوا عارفين filaria action lymphedema of the scrotum is a typical site. Where does the lymphedema develop most commonly? في اللور extremity طبعا. الليمفيديما بتاعت اللور extremity. How about the upper extremity? It develops post mastectomy. هي كده على طول. Lymphedema in the upper extremity is post mastectomy. If the breast has been removed, then you should be looking for something, and obviously it may be deposits. But in the upper limb, lymphedema equals post mastectomy. طبعا the female, then the mastectomy in the male is it's something that is not heard of. It's very rare. لكن كمان في lymphedema of the scrotum. في scrotal lymphedema مشهورة قوي ونتكلم عليها as one of the swellings of the scrotum when we review them in a minute. لكن كده احنا خلصنا بالهارزيزس. عايزين بقى ننتقل لاخر واحدة. البلهارزيزس طبعا الانتي بالهارزيز تريتمنت اخر واحدة اللي هي الفيلاريا. والفيلاريزس دي زي ما بيقولوا disease of lymphatic. انا نسيت اقول لكم بس بالهارزي روزري. A beaded vase. A beaded vase is that of TB. A bilharzia rosary. Oh, behind bilharziasis. And the matted cord. A matted cord is filaria. A matted cord. ساعات بيقولوا عليه when the whole thing is really enlarged and it's with filariasis, it extends into the canal. يسموها the pipe stem. is the pipe stem appearance. They describe it as a pipe stem. وعندكم هم الحاجات اللي بتكاركترايز these lesions. It's very easy. انتوا انا عاوز توزعوا معانا شويه الفيروسين عشان عاوزين نبتديها في لحظه دلوقتي. لو انتوا عارفين حاجات كتير عن الفيروسين اوريدي. يمكن مره تانيه اقول لكم والتي دي the vase is needed. والتي دي the vase is needed because it's duct borne. The tubercles form within the duct, which is the vase. There is a region of the tail, there is a posterior ulcer, and there is rarely iodocene. There's also a nodule or tubercle of the seminal vesicle and the prostate. Okay? But the TB with syphilis, it's syphilitic otitis. There's a iodocene and there's an anterior ulcer with bilharziasis. There's a nodule in the seminal vesicle in the prostate. Possibly, not necessarily. And there is also a lesion, strictly speaking, within the scrotum that is of variant size. It leaves the vase separate, and that does not involve the vase. It is a disease of veins. And bilharziasis, as you all know, is a disease of veins. And the granulometer are present wherever there is a plexus. It's present within the scrotum, strictly speaking, in the scrotum. Okay? Then maybe how to see because the veins are blocked. لا بس الباز ولا لا؟ ما هو الباز يتسبرد بمسافة لوحده. فالواحد يحس الباز. الواحد يبلبل the vase. Within the cord, you cannot feel anything separate except the vase. They want to feel the vase, whether there are beads along the vase, whether there are no beads. It may not be very easy, but in this situation, the vase is normal, it is thick as usual and normal, but there is a mess outside the vase. بقى مع الفلاريا عشان نخلص بس والفلاريزز. طبعا الفلاريا دي lymphatic. What is the organism or what is the agent responsible with Schlerer and Crofty? كلكم عارفين microfilariae that lives within the lymphatics and causes obviously obstruction of the lymphatics. في 4 forms of filariasis in the area ودي بتبقى basically a funicularis. دي affection of the lymphatics. البلهارزيزس برضه funicularis. التي بي basically epidermitis. Leprosy or syphilis are basically orchitis. Leprosy is an orchitis. Syphilis is an orchitis. The TB is an epidermitis because it's duct-borne. Well, because filaria is lymphatic and the bilharziasis are venous diseases, they affect the cord where the lymphatics and the veins are. They affect the cord. It's basically a funicularis. كل واحدة مكتوب عندكم في البوكس من أول. If you read them thoroughly once or twice, they're done. ففي 4 forms of filarial funicularis. Acute funicularis, where there is fever, redness, warmth, severe pain, and so on, rhinos and so on, because of superimposed streptococcal infection. دي واحدة. لكن كمان في ايه؟ If the lymphatics become obstructed, فبالتالي الكرونيك يسموها ساعات lymphocyl. The lymphatics feel like a varicocele but they don't empty. يبقى like a lymphocyl. وساعات يبقى في diffuse hydrocele of the cord. The cord becomes edematous. يسموها diffuse hydrocele of the cord. لكن في نوع اللي هو الكرونيك فانيكولايتس. في 4 انواع. الفلاريا لها 4 انواع. الانواع الاربعه اللي هم الاكيوت والكرونيك والليمفوسيل. diffuse hydrocele of the cord as opposed to the insisted hydrocele of the cord. diffuse hydrocele of the cord refers to كده diffuse edema of the cord. It's a vague term. لكن يفضل لنا في حاله اللي هي الكرونيك فانيكولايتس. كرونيك فيلاريا فانيكولايتس اللي هو معاه ده lymphangitis بس مش بس lymphangitis and perilymphangitis. And it's this perilymphangitis that involves the vase and makes the vase matted. The cord is matted, very typical. Matted, يعني ايه matted? يعني you cannot feel the vase as a separate structure. If the vase is needed, it's CB. If the vase is normal, but there is an intrascrotal mass, strictly speaking intrascrotal, and then there may be one on top of the other, it's a bilharzia rosary, while if the cord is matted, that is to say you cannot identify the buzz separate structure, it is filari. وناقص حاجة أخيرة على الفلاريا طبعا فيها هيدروسيل ولا ما فيهاش؟ فيها سكين انفولمنت أكيد لأن دي فلاريا، لكن الحاجة الأخيرة إن if there's a mass, the mass extends into the scrotum because there are more and more lymphatics as it extends into the canal. وتبقى الماسف تايب يقول عليها the pipe stem appearance. pipe stem يعني البايب ستيب. فاحنا عندنا حاجات اللي بتختصرهم طبعا. the treatment بقى is basically anti-streptococcal. انتوا عارفين الهيترازان that we give to kill the microfilaria. You may go upstairs and turned out. بس اقول لكم مره اخيره with filaria, cell vesicles and prostate are normal. The skin is involved. The tunica, there may be fluid. If there's a mass in the cord, the buzz is not well separate from the mass, it extends into the canal, giving the so-called pipe stem appearance. بعد كده بقى عندنا ورقه ثانيه، يلا عشان نبقى ابتدينا النهارده بكره باذن الله الفاكسين، والثلاث هنبتدي الانتي سكروتم عشان عاوزين ان شاء الله يوم الاثنين نكون مبتدئين الهرني. كلكم معاكم الفاكسين، ورقه الفاكسين باذن الله الاثنين الجاي. النهارده يوم ايه؟ النهارده الاحد، يعني مش بكره، الاثنين اللي بعده باذن الله نبتدي الهرنيا. اول حاجه هنبتدي بيها how to examine الهرنيا، we should be very quick with that. انتوا عارفينها. قولوا. ده بيبقى الانفيديما. بيبقى الانفيديما اللي هي توصل تاني في الانفيديما. اوكي؟ سكروتال الانفيديما. فدلوقتي عاوزين نتكلم بس على الباريكوسيل الاول. يعني ايه سيل؟ يعني سيل طبعا يعني swelling. The swelling that is formed over veins. انا عاوز اقول لكم في الاول ان انا كام كلمه كده على الجنرال، لانه varicocele is very similar to varicose veins at the end of the day. It's no more than that. If you want to investigate varicose veins, you get these things. How do you investigate varicose veins? A duplex venous scan. You do not get venograms. Fish. If you want to investigate the veins, if you're keen on investigating the veins, you get a duplex vein scan. دي standardized. دي حاجة standardized ما فيهاش يعني كلام. You very rarely ever get a venogram. The same rule follows. If someone has got a varicocele, you want to examine them, you want to investigate them, you're getting a venous scan of the scrotal veins. Okay? Venograms are very rarely resorted to, but remembering that nowadays, ده كلام عموم. ده كلام عموم أول. We got the CTV. We can perform venography using CT and using MR. So I talk about CTV and MRV. Like in the past, we used to inject the veins involved in order to visualize them. But dلوقتي gone are these days. We've got the duplex vein scan. And in duplex, what do you mean by duplex? Duplex and double. Duplex and double. Something that shows flow and picture of the vein. But this is a duplex. The duplex refers to something being double. فممكن تقول على أي حاجة. Clinical features. The veins don't certain features. The veins have got certain features. Whatever you're dealing with, the veins become dilated, obviously most commonly in the lower extremity and scrotum, but also in the esophagus, versus and also in the inner canal. طبعا anywhere else. The veins that we see clinically are superficial on any side. They're tortuous. They're full of blood when level with the heart. Yani when you put them level with the heart, they're full of blood. They're full of blood. This is important. They're full of blood when they level with the heart. But if you put your arm at the level of your heart, it still remains full of blood. If it's not full of blood, then you've got a problem with your arterial inflow. Okay? يلا انتوا عندكم الحمد لله كلكم veins. If you elevate your limb, what happens to the veins? They empty. طبعا انا ببروجكت if you elevate the scrotum, the veins should empty. If they refill in 5 to 10 seconds, and the time's a bit more, maybe up to 15 to 30 seconds. بيسموها the venous filling time, because if the venous filling time is delayed, obviously you're talking about a problem in inflow. Again, يبقى في ischemia. يعني ده بالمره بقول لكم congestion dependent طبعا they congestion dependent. اكيد oral proximal compression. You all know that when we're keen on a venous puncture, we apply a tourniquet. They're not pulsatile. طبعا neck veins have got their pulsations محطوط عليها. They're compressible. They're compressible. Veins are compressible. Okay. وكمان they show an impulse, maybe a thrill of cough when you cough or you perform Valsalva. When you take a deep breath and you expire against a closed glottis, obviously you may very well feel an impulse in the thrill of cough. يعني كده انا بقول لكم the signs of a varicocele and the signs of varicose veins in the lower extremity. And the varicoceles are compressible, where if you cough, there may be an impulse on the thrill. If you relate the scrotum, they empty. If they don't empty, يبقى في مشكلة obstruction. يعني a varicocele that doesn't empty on the dilation of the scrotum means that the spermatic veins are obstructed probably by tumor. The varicoceles are very common. They're very, very common. They're not important whatsoever. But at times we encounter a male who's already married and they're infertile, they've got a varicocele, and we think that the varicocele is the cause. دي حاجة معروفة at the times you perform an operation for that very reason. Or at times a male has applied for a job, and then while they're examining them, they find the varicocele. They're worried about them every now and then saying that they've got the varicocele and they're in pain, that they want to treat it before they're accepted in the job. يقول عليها failure in a medical commission. يسموها failure in a medical commission. فدي سراب varicocele present طبعا غير البين. بس تاني مرة clinical features with investigations. If you want to investigate veins, you get venous duplex scan. دي حاجات foundation. Okay? وزي ما انتم عارفين clinical features, what you see, obviously you don't see the deep veins. You don't see the deep veins. In the scrotum it's different because the skin is very thin. But otherwise, what you see are the superficial, not the deep veins. But they're superficial. They occur in any side. They've got a typical color, whatever the color, blue, green, whatever. They're tortuous. They're full of blood on the level of the heart. When they're dependent, they should be full of blood. They empty on elevation. They refill in 10 seconds. Now at times a bit more. They're congested and dependent, or on proximal compression. They're non-pulsatile. Now the neck venous pulsations, put them aside. Then if the veins are pulsatile, if the veins anywhere else are pulsatile, it's like muscle of an AV fistula. Pulsating veins. If the veins are pulsatile, and we're talking about an AV fistula, where they give an impulse, and maybe a thrill on cough, on Valsalva, and they're compressible. Okay? How we treat veins? Blood behind varicose veins is very ligation. لكن هم عندنا أول طريقة elevate and compress. انتوا عارفين the best way to treat varicose veins in the lower extremity is to prescribe a compression stockings, a pair of stockings. دي حاجة معروفة. And in fact, this is the best method, and to keep walking and not putting your legs in a dependent position, not stand for a long time, not sit for a long time. Elevation and compression. Well, that is why at times with the scrotum we prescribe a scrotal support. Well, this is not very good for reasons that we mentioned. Like at times if the pain is severe, you prescribe scrotal support. The scrotal bandage or scrotal elevator that we use. Now you can inject veins. Sclerotherapy. Who hasn't heard about sclerotherapy? You may sclerose the veins. هنتكلم عنها بس بالتفصيل بكره ان شاء الله. وطبعا you may perform surgery. Well, surgery is very primitive. A varicose vein is either ligated or excised. You excise the veins, or you ligate the veins. You excise them or you ligate them. معروفة في lower extremity. If you're not very happy with the great saphenous, you strip it. Very primitive. يعني لو انا حد مضايقني اقوم بتخلص منه. ولو انا مضايق مني يقوم يتخلص مني. حاجه بدائيه جدا 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 because the better way of doing it is to know how to deal with someone you're not very fond of. طبعا the best I would like very much to be the very one person اكيد لكن because this is not possible this is very limited. Get rid of what you don't like. Get rid of what doesn't function. ماشي البروبر واي. وخلوا بالكم انا لما بقول حاجات بعمل حاجات ساعات كتير مش بقول كلام كده ان الطب ده فيه ايه؟ فيه بروجكشنز كتيره طول الوقت نون ريكونستراكتيف. الجراحين مضايقين قوي في تفكيرهم. بالظبط you're unhappy with the spleen, get the spleen out and throw it in the bin. You're unhappy with whatever, get rid of it. بس الحمد لله بيتقلصوا يعني الطريقه دي بتقل لان بقى طبعا في ريكونستراكتيف في طرق ريكونستراكتيف which are better. The results are not so good as yet, بس they're already ongoing. يبقى if you want to treat veins, you either conserve and prescribe elevation compression, or else you sclerose them, or you operate. ثلاث طرق مسهلين قوي يعني. You operate, أو you sclerose the veins, أو you prescribe compression, elevation, and times what we call venotonics. يعني no vascular surgeon has never written the drug that we call dafron. في dafron كده، في drug اسمه dafron, you're عليه venotonic. So we all keep writing them. All patients with varicose veins are given this as a venotonic, whatever that it does. فأدي veins in general. With the tests بقى because this is our concern. احنا فاضل لنا معرفش محدش جاي علينا ليه بس فاضل لنا دقيقة ونخلص. The veins in the cord are three groups. هنخلص من الكلمة دي. في spermatic veins أو testicular، لكن في كمان differential torus deferens، في كمان cremasteric. The veins within the scrotum are three groups. We'll talk about the layers of the scrotum very soon مع الهرنيا، إنها لازم تبقى مع الهرنيا أو أنا شايف كده spermatic differential cremasteric. ففي 3 groups of veins موجودين في السكروتم، بعد كده في الانجوانال كانال، بعد كده كمان الريترو بيريتونيوم. طبعا انا بحضر عشان لما نيجي هنربطهم في different layers. يعني لما نيجي نربط الفينز مش هنقول varicocele is treated by ligation. ليه ligation؟ Because we think the theory is that the vein, the junction of the spermatic vein with the cava or the renal vein refluxes. احنا بنربطه عشان الريفلكس ده يتمنع. طب نربطه فين؟ في السكروتم، في الانجوانال كانال، يا ريتروبيرتونيوم. Which groups of veins are we dealing with? Usually the spermatic, the so-called campaniform، لكن ممكن يكونوا differential او cremasteric. كده نطلع فوق بقى من الساعة 8:10 وهنكمل بكره باذن الله. بكره varicocele، بعد كده هنسند تيست.